What is up, guys? Dr. James Stirrett here. Today, I'm going to be addressing a question that I get frequently from many patients, both on and off of semaglutide. The question is, what is the best starting dosage? So let's dive straight into this today. What we need to address first is this issue of, are you diabetic or are you not diabetic, right? So if you are diabetic, your doctor may choose to start you on a higher dosage of semaglutide. And that is not necessarily what I'm going to be talking about today, because they may be using metformin, they may be using some other medications along with semaglutide to help with your glucose control. I am just talking about this from a weight loss perspective. So at the moment, it is the wild west of semaglutide and weight loss out there. Anyone can hop online and get yourself a semaglutide prescription these days. I will say this is much less expensive than going and buying it conventionally, brand name, Wegovy, or Ozempic, unless it's covered through your insurance company, which by some miracle it is for some people. Most people, unfortunately, it is not. So the compounded version is an awesome option. However, the doctors that are on the other end of your screen prescribing this to you are often, one, not very educated with the medication. They see a ton of patients per day. I hate to say it, but they don't necessarily care about you very much. They're just kind of racking them and stacking them, prescribing them. They're being paid by these clinics to actually retain you, help you lose weight, but their answer to you not losing weight is just going to be to increase your dosage. So what will happen is that these doctors can inappropriately prescribe this medication, often too much, too soon for you. And in doing so, yeah, you're going to lose weight, but you are going to have side effects. And most people come to me saying, hey, I have really bad side effects, or I'm on this huge dosage, I'm not losing weight, what's going on? And I'm just rolling my eyes like, man, no one really took the time to figure out what was going on. Before telling you what my favorite starting dosage is, know that I am a doctor, but I am not your doctor. So this is not medical advice. It is just what I have seen with countless patients in practice and what I personally do. If you look on the Ozempic website, it will tell you that they actually start people off at 0.25 milligrams. I do not see this done almost anywhere. Most people are starting off at 0.5 milligrams or 1 milligram. I, on the other hand, like to start off at 0.25 milligrams once per week, and I like to hold this for at least 2 weeks and just to see how things go. Really, like, we will see people lose weight on this dosage. Some people are just so sensitive at this point that they're going to immediately have side effects. Maybe it's not a good fit as a medication. They're either going to have side effects, maybe they'll start losing weight, maybe they just won't be hungry at all, maybe they'll be constipated. This is a good time as a provider to deal with these side effects before increasing dosage. But what do we do in the industry? We just see people launching in up to 1 milligram, 2 milligrams super fast, and they're not going to the bathroom, they're nauseous on their injection days, and this really isn't how we want to play this. So if you're able to inject 0.25 milligrams initially and deal with those things if they come up, it is a very low dosage. Then instead of then going and increasing it to 0.5 once a week, I highly suggest going 0.25 twice a week or every 4 days. This will give you a continuous amount in your bloodstream as your body's breaking it down throughout the week, give you a little bump, and in doing so, you're not spiking your levels with putting as much as 0.5 actually is in your system. You're just continually dosing throughout the week. This will greatly reduce the potential for side effects as you increase your dosage. And so I like for people to start there. Usually 1 to 2 weeks is enough time to know if somebody needs to increase to that second dosage. I'd say 50% of the time, they might not need to. The other 50% of the time, yes, it needs to be increased, but that is for you and your provider to decide. So 0.25 milligrams is really easy to achieve if you have a compounded product. You're just going to be able to calculate with your milligrams per milliliter how many milligrams that is in units, and you can just go ahead and ask your doctor that's prescribing it to you what that actually is. They should be able to figure that out pretty easy. If not, find a new doctor. Otherwise, perhaps insurance is covering it or you're paying out of pocket for Wegovy or for Ozempic. Let's talk about the Ozempic pen real quick. There are 3 different options of various strength. The first and entry-level option is the only one that I actually recommend for Ozempic. So what you'll see is it has a dial on it. So you can actually dial it from 0.5 milligrams to back down to 0.25 milligrams, which is really, really awesome. Now, where I see clients or other patients make a huge mistake is they go to their doctor prescribes the 1 milligram pen or the 2 milligram pen starting out. It does not give the option to dial. So if you are going to be getting the brand name medication, be aware of this. Make sure to request that lowest level pen that actually has the ability to dial. Just for your reference, that is the 2 milligram per 3 milliliter subcutaneous pen injector. Hopefully that helps for those of you who are going brand name. If you are enjoying this content, please hit that like button and subscribe. Make sure to turn on your notifications bell so you can see when new content is released for hormones and weight loss. That is what we talk about here on this channel. I'm Dr. James Stirrett, and I will see you again next week. Take care.